Thank you, Mr. President. Mr. President, I come to the floor today to talk once again about the health care law. And this past weekend, I was home again in Wyoming, as I am just about every weekend, was at a community called Lovell, Wyoming. And in Lovell, we had a health and fitness fair, and it was focused on kids and adults in terms of prevention of problems, early detection of problems. People can get their blood tests done there, and talking to hundreds of people there at the hospital, what I heard again and again, as I do each weekend, is that this health care law is having a negative impact, a hurtful impact on the people at my home state of Wyoming. And I want to just spend a little time today talking about what's happening there. On Monday night, Senator Enzi and I had a chance to have a telephone town hall meeting, talk to a lot of people around the state. This continues to come up, the high increases in costs in spite of what the president has promised. He promised insurance rates would go down by $2,500 per family if his health care law was passed and signed. And in fact, the exact opposite has occurred. Today I had lunch with a number of students from Lander, Wyoming and Fremont County, and this again came up as a topic of discussion. And what we see is the insurance companies at this time of year are turning in their rate requests, the requests that they have to increase their rates for next year. And those rates are becoming public. For instance, some families in Iowa, and I'm going to talk about places all around the country now because it's not just Wyoming who is suffering under the president's health care law, but it's all around the country. Families in Iowa now know that their insurance company wants to raise premiums by as much as 43% for some plans. Some families in New York have learned that their rates may be going up as much as 46%. And then let's turn to New Hampshire. There are families in New Hampshire who have gotten the news that they could be paying 45% more. So, you kind of look state by state by state, and what we're seeing across the country, rates going up dramatically, impacting the ability of people to even afford their insurance. There is a healthcare group that looked at 9 states where information has been released. They found that they call what they call a standard shopper for insurance, that the average cost of a silver plan, which is the most commonly sold plan, would go up about 16% next year. Now, that's for a typical, say, 50-year-old person who doesn't smoke. It adds to an average cost of about $6,300 per year for that person trying to buy insurance. So today what we're seeing is more and more people are getting sticker shock under Obamacare. The health care law has created so many problems for the American public, for taxpayers, because taxes have gone up as a result of this, for providers of health care, and certainly for patients. The health care law has caused mandates, has put restrictions in place. It's been made so expensive that most people think it's not a good deal for them personally, which is why in terms of the number of people that were uninsured when the law was passed, I think fewer than 1 in 3 of them has actually signed up for Obamacare. That's because all these mandates, all these restrictions have made insurance much more expensive when it comes down to actually trying to get care. And let me point out, the president is very specific when he talks. He doesn't talk about people getting care. He talks about coverage. Well, the headlines in the New York Times have been that there are lots of people with coverage who can't get care. Story last week about so many people in New York City who feel that Obamacare is a second-class program and that they have that insurance card, but it doesn't help them get to see a doctor, and certainly not one that they want or need for the problems that they're having. Now, some insurance companies have lost so much money by selling insurance on the Obamacare exchange that they've decided to drop out of the exchanges entirely. They said, we're done with it. We can't afford to continue to sell it this way. We know that the insurance company Humana is dropping out of several states. We know that United Healthcare is leaving all but a handful of states. In Colorado, 20,000 people have gotten letters saying that they're losing their insurance plan next year because companies cannot afford to sell it. And it's only going to get worse. According to a recent survey by McKinsey & Company, turns out that only 1 out of every 4 health insurance companies made a profit last year. Those are ones that I'm talking about, specifically selling insurance on the Obamacare exchange. So 1 out of 4 made a profit, 3 out of 4 lost money, And you say, how is it that they were able to make a profit? Well, this is what they did. The ones that were able to make a profit tended to be the companies that have a lot of experience offering Medicaid insurance, which basically they took their Medicaid plans and sold them to people on the Obamacare exchange. Now, these are plans with very narrow networks of doctors, so you just can't go to any doctor you like. Very narrow numbers of hospitals, so you can't go to any hospital you like. And for these specific companies, a lot of these plans are ones that have very high deductibles. So somebody may have an insurance card, but the deductible is so high, the dollar per dollar out of their pocket expense, that they say they can't afford to see a doctor, and they have Obamacare, which they're finding is essentially useless for them. You know, there were different levels of insurance plans that the Obamacare plan came out with: bronze and silver, gold, platinum. And most of the people have been choosing the silver plans because that was thought to be sort of the mid-range plan. Well, now those silver plans are coming with very high costs. And this means that people may be paying, again, for coverage, but they're not getting care. There's a company in Virginia, and what they've decided to do, interestingly, is they're getting rid of the bronze plan entirely. They said, no, we're not going to sell the bronze plan anymore, and they're pushing all of their customers up into the silver plan, and they're doing this. But if you're one of those people that has had the bronze plan that they're not going to sell anymore, well, you can see your rates going up 70% from what you were paying this year. So an increase of 70%, and some of these silver plans have gotten so inadequate that they're now what the bronze plans used to be. So this is all as a result of what the Obama administration forced down the throats of the American public, and every Democrat voted for and every Republican voted against. One insurance company is actually offering a silver plan next year that comes with a deductible of more than $7,000. Now, that's how much someone would need to pay out of their pocket before insurance actually kicked in. Blue Cross of Idaho is talking about a deductible for their silver plan, $6,850. That's for the silver plan, the one that the Democrats said was supposed to be the benchmark plan, the one that the subsidies are linked to. Well, let's think about what a $6,850 deductible means for most people. According to a new poll out by the Associated Press, 2/3 of all Americans say they would have a hard time actually coming up with $1,000 for an emergency. So then how are they supposed to come up with over $6,800 in case of a situation that they may find confronting them? Well, these kind of plans where people pay a lot and don't get much in return, they're what President Obama and the administration used to call junk insurance. And I remember the president talking about that. Junk insurance is what he said. He said that the health care law would stop that. That would never happen under an Obama administration or an Obama plan. Well, instead, this president under Obamacare is pushing more and more people into these kinds of plans. And this administration is even subsidizing them. So the premiums are going up through the roof. The deductibles are going up so high that people have insurance, which is mandated by law that they have, but it turns out that for many of them, it's useless. Well, people may have to find a new primary care doctor or a new pediatrician every year because they're getting switched from plan to plan to plan because they can't afford the plan that they have, and the rates continue to go up. And the president, who at once said that if you like your plan, you can keep it, now he says, oh, no, you better shop around. You like what you have, you can keep it. He completely flipped, and now you better shop around. People continue to lose plans because insurance companies are going out of business, or they just quit selling insurance entirely. And to me, this is just one more sign that this health care law is a sinking ship. It's falling apart. And insurance companies have found that one reason they're losing so much money is because their customers are sicker than the president thought they would be and that the insurance companies thought they would be. The people who are healthy basically aren't interested in buying this very expensive insurance. They feel it's their wasting of their money, and rather they just pay the fine to the IRS. On Monday, the head of the state Obamacare co-op in New Mexico, he was on CNBC, the television network, talking about this problem. His name is Dr. Martin Hickey. He's the CEO of the New Mexico Health Connections. His company is asking to raise premiums for some of its plans by 34% next year. Still, he said, with these heavy rate increases, and these are heavy rate increases, he said the problem is that the people who are going to say, well, for a $695 penalty, the heck with it. So the people the president are mandating to buy insurance, many of them are just saying, the heck with it. That's what we hear from this CEO. Look, this is just what Republicans have been predicting ever since Democrats first brought this health care law to the floor, and they passed this extraordinarily expensive law and mandates on the American public. So now Dr. Hickey, from the CEO of the New Mexico Health Connections, he said, the healthy are abandoning insurance. And what you're left with, he said, is the sick, and you can never raise your rates high enough. Well, that's not what the Democrats on this floor promised. That's not what they stood up here on the floor and talked about. They promised, and so did President Obama, that the health care rates would go down. They promised insurance coverage would get better. It's not. It's gotten much worse. They promised that if you like your doctor, you can keep your doctor. In many cases, you can't. They promised if you like your insurance, you could keep your insurance. In many cases, you cannot. People all across this country are getting a reminder of Obamacare's broken promises as the health care requests for increases come out. Democrats want to double down on this failed health care law and add more mandates and more restrictions. They want more government control over people's health care. It does seem that everything the Democrats propose just makes prices go up faster. That isn't what the American people wanted, and it's certainly not what we need in this country from health care reform. This law was passed 6 years ago, and I'll tell you, it is just getting worse every day. Thank you, Mr. President. I yield the floor.